I would like to call the Legislative Affairs Government Operations Committee to order at 9:32. And we'll begin with roll call.
Nelson?
Here.
Gengel is absent notice. Gershenson? Here. Lubes? Todd?
Here.
Quarles?
Here. We have four. Would you join me in the pledge of allegiance to the flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Approval of the minutes for June 12th, moved by Commissioner Gershenson, supported by Commissioner Nelson. Any discussions or questions? If not, all in favor say aye.
Aye.
Opposed, same sign. Motion carried. Approval of the agenda. Moved by Commissioner Nelson, supported by Commissioner Gershenson. Any discussion? You have to do a roll call? Okay. All in favor say aye.
Aye.
Opposed, the same sign? Yes.
Are we on the communications now?
No. Okay, just did the agenda. Public comment is scheduled next. Do we have anyone for public comment? Okay. Would you take a seat at the end and state your name? What the city?
Just her name.
Just a name.
Who she represents.
Just my name.
Name, title, and representative. Good morning.
Good morning. Thank you very much for allowing us to come. I'm Maureen Elliott, and I am from Community Affairs and Government Relations for Beaumont Health. We've brought some representatives from Beaumont today, and I'd like to introduce them. So we have Nancy Sussick, who is an RN, our president of the Royal Oak Beaumont Hospital. Debbie Guido Allen, RN, Chief Operating Officer from Beaumont Royal Oak. Ann Stewart, RN, our Chief Nursing Officer, Beaumont Royal Oak. And we have two more people coming, and if they come, I'll introduce them as they arrive. And also, we have Ryan Zayans, he's our administrative fellow. I'm sorry, I almost forgot you, Ryan. We're here to provide context and background in light of Commissioner Dave Woodward's resolution and in response to 3 nurse statements at the June 12th Oakland County Board of Commissioners meeting. And now I'd like to turn this over to Nancy Sussick.
Good morning.
Morning.
Thank you, Maureen. And as Maureen had said, I am Nancy Sussick, and I'm the president at Beaumont Royal Oak. I am a nurse. And we are here to talk in response to the letter that you had received on June 25th that it really outlines, it went to the commissioner, outlines the facts as we see them in terms of some things going on at the Royal Oak campus. We do not believe that the nurses' June 12th comments at the commissioners' meeting really reflect the entire reality of nurses at Beaumont Royal Oak. We believe there's a vocal minority, about 3% of our nurses who want to form a union through the Michigan Nurses Association. There's also a group of nurses who've taken it upon themselves to make sure the record is heard about the non-union point of view. What I'd like to just really talk about, I think it's important to give you some context around Beaumont Royal Oak and about me and some of our leadership team. As I said, I'm a nurse, and I've been the president of Beaumont Royal Oak Hospital for about 5 months now. I've been a nurse for 33 years. I spent my entire career at Beaumont Health. My first job was at the Royal Oak campus as a staff nurse. I subsequently held many leadership positions over many years, for about 14 years at Royal Oak. And then I went to the Troy campus in 2000 to lead nursing in a time when the hospital system at Troy was really beginning to grow. At that point, I held positions as a CNO, the COO, and the president. And during my leadership at the Troy campus, the hospital grew from 200 beds to 520. And we received multiple awards and recognition for quality safety service. We achieved magnet status, which is the highest designation of a nursing organization can receive for nursing excellence. 5 months ago, when I went to the Royal Oak campus to assume the role of president, I was extremely proud and privileged and honored to be asked to lead the Royal Oak campus. The hospital's 1,100 beds. It's a major teaching academic referral center with level 1 trauma and pediatric trauma. It's designated, has many designations for complex care, and in 2018, we were recognized nationally for many different specialties. We ranked number 2 by Michigan hospitals by the U.S. News and World Report, and this happened for 24 years in a row. In terms of safety, quality, and recognition, Beaumont is right at the top. It was the first, Beaumont Royal Oak was the first hospital in Michigan to be recognized as a magnet designated hospital, and it's been designated 3 times since. It has a high level of designation for nursing organizations can receive for nursing excellence. Only 8% of the U.S. hospitals receive this designation. Our recent nursing engagement has been 80%. We have a turnover that's 9%, which is well below the national average of 14 to 16%. And due to nurses, the turnover we have seen has been into other positions within the organization for nurses wanting to advance into nurse practitioners, CRNA roles, and others. Recruitment has not been a challenge for us. We have absolutely no issues with recruiting nurses to our organization. Our vacancy rate is about 4%, and all making Beaumont a really great place for nurses to work. I also proudly served my country in the United States Navy for 24 years as a Navy Nurse Corps officer. I held many leadership roles throughout the Navy and retired as a captain just a few years ago. And why I think this is important is because I still do understand what it is to work at the bedside. I worked as a staff nurse until I retired in the military on weekends and when I was deployed, during weekly trainings throughout my 24 years there. So I do truly understand. I think that's important to have as a nurse. I chose to stay at Beaumont for 33 years because of the autonomy and the empowerment I had to practice in every role I had, from nursing to leader. The quality of care, I believe, never wavers and is continually enhanced. The environment, facilities, staffing, equipment to do my job and care for patients is always there. And most importantly, we focus on patients, our families, and the communities. As president, I have a duty to listen to our employees and keep us focused on our patients and families and provide the necessary resources and great environment for our nurses, physicians, and all staff to perform their jobs effectively, efficiently, and compassionately. So over the past 5 months that I've been at Beaumont, what I've been doing, as Beaumont is a learning organization, I've taken my new CNO and Chief Operating Officer, who are both nurses and have over 30 years of experience also within Beaumont, and we've been walking around listening to our nurses and trying to understand what are some of the concerns, what are the issues, what's the great work that's happening at Beaumont. And as I've described already, there's tremendous work being done by our nurses throughout our organization, and I'm really proud to be there. But during those sessions, I also heard from many of our nurses, what is organizing? What does it mean to our nurses? And what does it mean to me as a staff nurse? What will my life look like? How will it be differently? And I know that this is such an important decision that I need to make. How can you help us understand what this means? For that very reason, that's why we at Beaumont Leadership brought in educators that are talking to our nurses about what the NRLA is, the National Labor Relations Act is, what is the NRLB, what is the process? They just didn't know the process. So we brought in educators to really help educate our nurses. In the past 5 months, I've actually formed a very strong nursing leadership team They have strong backgrounds, as I've already alluded to somewhat, and we are dedicated and committed to listening to our nurses, physicians, and staff, and partnering with them to make Bowman a workplace of choice that it is today, and continue to strive to be the national leader for patient-family centered care. I'd like to end with my comments with, I'm very proud and privileged to work for organizations that's focused on patients, families, the community, the nurses, physicians, staff, and volunteers. You will find Beaumont has multiple members of the same families who have chosen to work at Beaumont and are very proud to work for the organization. I have a son who's a nurse at Beaumont and chose the Beaumont for reputation, quality, and patient care provided, the work environment, and opportunities to grow, compensation, and benefits. My daughter, who recently graduated as a physician assistant, also accepted a position for the same reasons at Beaumont. I'm committed to supporting our nurses and working with them so that together we can make Beaumont an even better place to work. I'd like to ask Ann to come up and make some comments.
Morning. Thank you for giving us a few minutes to talk to you today about Beaumont Royal Oak and the great things that are going on at Beaumont Royal Oak. I'm very proud to be the new Chief Nursing Officer at the Royal Oak campus. Actually,
Excuse me for
I'm
a
sorry.
moment. I apologize. I should have made this statement at the beginning. Your time for your comments are 3 minutes. And
Okay.
again, I apologize for not having said that earlier.
I'll stay. You just give me the sign and I'll stop, I promise you.
Thank you.
So I had come to the Royal Oak campus on March 18th. I came from the Grosse Pointe campus, where I had actually worked for 35 years. When the opening at Royal Oak came, I looked at it and I thought, wow, do I take the chance at my stage in my life? And I couldn't be happier that I applied and was appointed the chief nurse at the Royal Oak campus. My background in nursing was med-surg. I did a lot of labor and delivery. I was an off-shift leader for 17 years. Before I left the Grosse Pointe campus, I was the chief nursing officer for 6 years. I am very, very proud that the Grosse Pointe campus was designated as Magnet just before I left in 2018. It's a lot of work and it's a great journey that really is driven by staff nurses. And I couldn't be prouder of the staff at the Grosse Pointe campus for the work they did. And then to come, as Nancy said, to a campus where not only is it a 4th time designated Magnet Hospital, it was the first designated Magnet Hospital in the state of Michigan. And I know those that are in the room here that are nurses are very proud of it. They have done great work to get us to where we are. When we talk about Magnet, it really is the gold standard in nursing. It is the highest designation you can get. In order to get it, you must have a very strong nursing workforce. The workforce must feel that they have say and a voice in what is going on at their campus. I have to say that as I have gone around, as Nancy said, one of the things we've had to do is go around and really meet our staff, get to know them, get to know what their challenges are, and truly, I am amazed every day at the work they do. They do excellent care for our patients, and that's how they became Magnet designated. It's because of the quality of care and their independence in making sure that the care is what the standards it should be. One of the other standards with Magnet is that you have to have a self-governance model. The Royal Oak campus has a very strong self-governance model, which is run by nurses. It was reformed probably about 2 years ago, and they've done a fabulous job not only in having a professional nurse council, they have subgroups that deal with operational issues, staffing and scheduling, many things that in a lot of hospitals, the nurses really don't have a lot of say in that type of work. This last year, we've had some challenges, I think, that we heard when we did go around and listen to our nurses. We had some challenges with some supplies. I can go on with the list, but one of the things we did hear about is the pay. The staff felt that the pay was not where it should be. Every year, Beaumont does a market analysis. Being nursing is one of the largest workforces within the any hospital. They do a market analysis, and we are fortunate not fortunate that we needed to make adjustments, but fortunate that Beaumont made adjustments to many of the nurses' pay this last June based on the market analysis. there were 5,600 nurses that had an adjustment, and it was about an average of about 3%. That adjustment is totally separate from what would be normally what we may see in our fall pay rate adjustments. The other another benefit of being a Beaumont nurse, and one of the offerings that the hospital has, is for our nurses to join what we call a clinical ladder. So in the clinical ladder, the nurse, there's a certain criteria they need to complete within a year, and they can have the opportunity to have a $2,500 or a $3,500 bonus, and every year they can do that, and it really is a great way to grow as a nurse. And I know I'm out of time, so I'm going to stop and let my other colleagues have a moment. I'm going to introduce Debbie Guido-Allen. Again, Debbie is the COO. She came from the Troy campus. She and I both started on March 18th, and she's also been doing a lot of the listening sessions with us. Thanks, Deb.
Thank you.
Good morning. As Ann said, I'm Debbie Guido-Allen, and I'm the Chief Operating Officer at the Royal Oak campus. I started my nursing career at the Royal Oak campus in 1986. I stayed at Royal Oak for 15 years in critical care and cardiology, and I went over to the Troy campus in 2001, where most recently I was the Chief Nursing Officer. Started back at the Royal Oak campus on March 18th and have been just thrilled to be back. It's a wonderful institution. It's grown significantly since I left, a lot more territory to cover. As Nancy and Ann discussed, we started doing a lot of listening sessions just to talk to the staff across the hospital. Again, it's a big campus with a lot of people. So we spent time listening to what's working well, what's not working well, what can we improve on, what draws people to the hospital. With that, and now being the Chief Operating Officer, but still thinking and having the heart of a nurse, I oversee many of the departments that support patient care and support the work that the nurses do: environmental services, pharmacy, transportation. All of those, we heard a lot of concerns from our nursing staff and even our providers. All of those are undergoing significant updates and changes, restructuring, so that we can better meet the needs of the nurses. The pharmacy will tell you they've learned over the past several months that nursing is their customer, and they're really working to be hand in hand with nursing and being visible and partnering with them. Environmental services, transport, we're doing restructuring so that we can better meet the needs of the patients and families in our hospital, as well as the nurses and the providers that are providing that care. I'm also, by the way, a proud mom of a Beaumont nurse who came to the Royal Oak campus, came to Beaumont for everything that Beaumont has to offer the nursing staff, the ability to grow as a nurse and to take opportunities that, like I've had over the years, to advance far beyond whatever I thought I could get when I went to nursing school. Nurses are vitally important to everything we do at the hospital, providing quality, compassionate care. Without our nursing staff, we don't have that. So we do support our nurses. We support all of our staff. And I think now I'll turn it over to Susan Grant.
Good morning.
Thank you, and good morning. I'll stick to my time. Excuse me. I'm Susan Grant, and I am the Chief Nursing Officer for Beaumont Health for the system. And I have been a registered nurse for 37 years and in this wonderful profession for 40 years. My mom is a nurse, and my clinical background is in critical care and in oncology. And I just want you to know that I love nursing, and I'm very proud of my profession and have loved being a nursing administrator and working with my nursing colleagues over many, many years. Very proud to be a Beaumont nurse. I know that you are in receipt of a letter that was from Nancy Sussick and myself dated June 25th that outlines the facts as we see them and how we view our situation at Royal Oak. We do not believe that the nurses who made comments at the June 12th commissioners meeting reflect the reality of life as a nurse at Beaumont Royal Oak. We do believe that this is a vocal minority and represents about 3% of our nurses at Royal Oak who want to form a union through the Michigan Nurses Association. I also want you to know that there is another group of nurses who have independently come together and taken it upon themselves to make sure that their point of view is represented and heard, that they do not want a union. We also understand that some of these nurses have met personally with Mr. Woodward, and on June 14th, some of these nurses filed a grievance with the National Labor Relations Board stating that the Michigan Nurses Association is preventing them from distributing information in opposition of the Michigan Nurses Association point of view. Most importantly, we want you to know that we understand and respect our nurses' right to organize, and we also respect their right to not organize. And those are very important decisions that our nurses need to make for themselves and for their families, and we respect those decisions. But we do believe that it's in everyone's best interest that we are able to have open, direct communication, employer to employee, without a third party in the middle of that conversation. So with that, thank you very much.
My name is Mary Zatina. I'm Beaumont Senior Vice President of Government Relations and Community Affairs, and I am not a nurse. I don't think I could have passed all the exams and requirements. I just want to make sure you know that Oakland County Commission Chair Dave Woodward sent us a letter on May 22nd on commission letterhead outlining his demands for our behavior related to how we interact with our nurses. And since we received that letter on commission letterhead, we've been working very closely with the chairman to answer his questions. And in fact, he's requested a meeting at the hospital site, and that's coming up. So we have been working on this issue to make sure all the commissioners' questions are addressed, including the letter we sent you in June. So what I would like to do is ask you not to act on a resolution against Beaumont, Oakland County's largest employer. We think it's not an appropriate use of the commission's authority, nor a good service to the thousands of people who rely on Beaumont as a place to live, work, and get their health care. Thank you.
Did everyone sign in that spoke? Okay. You want to speak now, or you want to wait till I call you up for your resolution? Okay.
Comment, please.
Okay.
Helene Zach, Oakland County Commissioner. I wasn't planning on speaking, but for those of you that know, I'm a social worker. I had the opportunity and the pleasure to work at Beaumont Health for 7 years as a social worker for the employees, doing employee assistance program, and I had the opportunity to work with many nurses. And I just want to speak that I started my career at Beaumont at Troy and worked very closely with Nancy Sussick and Deb Guido-Allen on the behalf of employees. And I just adore these two women and was thrilled when Nancy became the president of Royal Oak and sent her a note congratulating her. It's my place of health care. I live 2.5 miles from Beaumont, and I want it to be the best that it can be, and I've used it way too many times and continue to use it. And I also am a union-endorsed candidate, too, and I've had the experience of working very closely with unions in the employee assistance program field and value unions, too. But my feeling about this resolution is that I support the right of any election. I support the right of nurses making the decision to vote for or against a union, and I support a healthy legal process of educating, organizing, whatever, and let the nurses decide what they choose to do. but also knowing that we have really special leadership that has come into Royal Oak, and I've seen it in action. So, thank you.
Okay, thank you, Commissioner Zhang. Any further? You want- Of course. For a different item. Would you introduce yourself?
Good morning, my name is Jennifer Elrod. I am a resident of Shelby Township. I don't even live in Oakland County. However, I've been a registered nurse at Royal Oak Beaumont and the Emergency Center for the past 3 years. I am proud to work at Beaumont and very excited to be working with my colleagues to form a union through the Michigan Nurses Association. We really find it important to have a collective voice, not only in our working conditions, but also the care we provide our patients and the community. I appreciate the resolution before the committee today. It means a lot to have that.
Excuse me, can we be respectful to our speaker?
This is an agenda item, so I don't know why it's doing it in public comment as well as on the agenda.
Well, we're doing it in public comment because most of them were told that they were going to speak in public comment. I apologize.
That's okay.
This is very complicated.
Okay, go ahead.
Again, it means a lot to have that support, to send a message that nurses should have the right to decide for ourselves whether or not to form a union. As a nurse, I always put my patients first. Beaumont is spending so much money and time on these outside consultants that add no value to patient care and in fact take away from it. While Beaumont may say it's just giving harmless information, I have not found that to be the case. The employer's so-called education meeting I attended was clearly biased against the union, giving only half-truths about what may happen if we collectively vote in favor of unionizing. These kind of meetings are still going on and attendees are being selected strategically. My meeting consisted only of nurses from my department that are outwardly supportive of the campaign. What's worse is that I was taken away from my patients to attend this meeting. I had previously asked to attend a meeting after my shift so I wouldn't have to leave patient care. I wanted to attend on my own time when my patients didn't need me and my coworkers wouldn't be burdened with additional patients to care for while I attended my session. My manager told me I could not, as that would be illegal to attend on my own time, and that the meetings only allowed for so many attendees at a time. So instead, I was pulled away for my session, leaving someone else to do my job in addition to their own assignment. I was also forced to leave a new nurse that is just beginning her 6-month orientation period with a different coworker while I sat through my meeting. She had already attended her session as part of her corporate orientation. My colleagues in the emergency center have been pulled away from critical care situations, leaving us even further short-staffed than we already are, just so they can be subject to this anti-union propaganda. I appreciate you considering the resolution today, and I encourage you to pass it so we can hopefully see an end to our employer trying to influence nurses. Thank you.
Thank you.
Morning. My name is Susan Schultz. I live in South Lyon, Michigan, which is within Oakland County. I have been a registered nurse for 26 years, 24 of those which have been at Beaumont Royal Oak. I want to speak in support of the resolution 19214. I am one of the nurses who asked the Michigan Nurses Association to help me and my colleagues organize a union at Beaumont. My fellow nurse organizers and I have talked with literally hundreds of our peers, and the vast majority of them support forming a union. I am one of a very large number, which I can assure you is well beyond 3%, of Beaumont nurses who believe that we should be able to decide to form a union without interference. Unfortunately, that's not what we're experiencing at Beaumont. A small group of nurses who are against forming a union at Beaumont set up an informational table in the cafeteria to promote their views. The following week, my fellow pro-union nurses also decided to set up a table to speak to our colleagues about unionizing. Our table was within visual view of the anti-union nurses table. On June 17th, the first day that we set up our table, I saw several very high-level Beaumont administrators stop by the anti-union nurses table, shaking hands and spending time talking to these nurses. None of them acknowledged our table. This sends a very clear message to me and my fellow nurse organizers that Beaumont administration obviously wants our union activity stopped. This whole situation felt very intimidating to me, to have our administrators totally ignore us and focus their attention on the anti-union nurses table. It seems that the administration was showing favoritism to these employees based on their views about the union. And it's a very scary thought to think that your job could be on the line just for asserting your federally protected legal right to form a collective voice in your workplace. I would also like to quickly share my experience of attending one of the so-called labor education meetings that the nurses are expected to go to while on duty. I found the man running the meeting to be very disingenuous, and he actually provided some very inaccurate information to the group. This man was also not wearing a badge. He refused to provide a business card and would not tell us who he worked for. I found this to be very unprofessional and suspicious. I don't think it's right for an employer to be holding these union-busting meetings during work hours, since it takes nurses away from their patients. And as a collective voice, we simply want to see Beaumont stop trying to influence so many nurses through scare tactics and fear, and to allow us to decide as a group. Thank you very much for listening to us.
Thank you.
So good morning. My name is Scott Lucht. I've been a nurse at Beaumont for 6 years, and I live in the county in Birmingham. And I am one of the hundreds of nurses working collectively to form a union at our hospital. And I do not believe that it represents a 3% group. There's far more people represented on my floor that I talk to daily that are interested in joining our union action. We want to work collectively to form a union so we can have a real say in the jobs that we do. We want to make Beaumont better for everyone, especially our patients. I'm very glad that the M&A has answered our request to come to support us while we work to do this important work. I'm also glad about Resolution 19214. I want to thank all the commissioners who sponsored this action. When Beaumont says they are just giving out impartial information about the union, that is simply not true. Recently, I was in a meeting of the Professional Nurse Council at work while being paid. The Nurse Council is a group of non-partial nurses who talk about issues with the goal of improving patient care and conditions. Unfortunately, our input in those meetings is never asked, and we have managers there representing, which is why I want to form a union so RNs have a guaranteed voice in our practice. I've been attending the PNC meetings, the hospital PNC meetings, for approximately 2.5 years. At this particular meeting, there were an unusual amount of managers present. At one point, the chairperson stood up and said she had been asked to make an announcement, and I quote, "We have forms that people can sign against the union. If we get 1,600 signatures, we can get rid of the union." She proceeded to hand out the cards. She also announced that there would be an anti-union table in the cafeteria. I'm sure you can imagine that is not hard to believe that is not intimidation when something like that happens with administration in the room. These kinds of things should not be taking place if Beaumont is truly willing to let nurses make their own decisions. I also agree with the others who say it's wrong to pull RNs away from the bedside to attend the mandatory labor meetings, education meetings. And I want to thank you again for bringing this resolution up, and I hope it passes today. Thank you.
Thank you. Okay. Any further comments? Then I will move, public comment is closed. Thank you for those who came out, and certainly feel free to stay. Moving to communications. Any discussion on communications? Yeah, Commissioner Tom.
Yes.
Oh, excuse me.
I'll move it.
Tom, moving it, second by Nelson. Commissioner Tom.
Yes, on the, I have three questions. On the first item, the contingency report, last item on the list, 19099, and it's the establishment of the Oakland County Complete Count Committee on which I sit. There is a line item, and I'm glad the Chair of Finance is here, for $7,300. I don't, has there a budget for that yet? Or not, I'm just asking. On the contingency report, it's a receive and file, item 19099. I'm just asking if there's a budget for that yet. Pardon? No, I'm not. I'm right here. Item A in communication, legislative affairs, excuse me, it's right there.
In the first item.
The first item,
First
A.
item, A, and then. in
The last
end,
item, yes, uh-huh.
okay, they
So
were-
I'm just wondering if there's a budget for that. Or we're just gonna give them the money and let them spend it. Or let me spend it. Just the question, I don't know. So would you,
I am looking for it, Commissioner.
It's
Because there was
the
discussion
first
about-
item in communications,
Yes, and I'm trying to find the line item you're looking for.
the very last line item, Madam Chair. 19099, end of the page, right above return to agenda.
Okay.
Yes. I just wondered if that's just a blanket amount, or if a budget, because I don't recall a budget being formed for that group. Just a question. So maybe someone can get back with me with the answer.
Madam Commissioner Tom, I don't know the answer to that, but I will certainly look into it and let you know.
Okay, then I'm on, the next one I have a question for is C. VIBA board minutes dated April 25th and May 16th. Okay, let me just see if I can bring it up. Oh, that's the wrong one. I've got to be able to get to it first.
I can answer the question on
Okay.
the complete count.
Okay, you want to take a seat? While you're looking for that, Chris will answer the question.
Okay, thank you, I have it.
On the complete count, first of all, Madam Chair, I wish somebody would have called me about the wearing black and white today for all the commissioners and to the chair of the board too. I think we feel left out. Commissioner Zach was called, all of the lady commissioners were called. In the contingency report, the amount for the complete count committee is for the per diems for the non-commissioner members. So that's the budget for the complete count. So it's there's no expenditure other than the amount for the per diems for the members to attend.
Okay.
Is that satisfactory?
It's $90.
No, no.
No?
The money is for the per diems, that's what I understand.
Yes.
Okay, I got it.
Okay.
I understand that. Okay, thank you,
Okay.
Mr. Ward.
Thank you.
Okay, the next one are the VIBA board, May 16th. Okay, the first set of minutes, the meeting was held on April 25th, 2019 at 3:55 PM in the West Oakland Conference Room. Okay, and it was adjourned at 3:56, so it was a 1-minute meeting?
Commissioner, I would certainly have to, actually, Mr. Chair, you want to address?
So, you're talking about the VIVA meeting? Right.
It says that the Oakland County Voluntary Employment Benefits Association VIVA Board was held April 25th, 2019 at 3:55 PM. And if you scroll down to the bottom, the chairperson adjourned the meeting without objection at 3:56.
So, the pension boards, we've got there's a series of meetings that happen during there. There's the VIVA meeting, there's the defined contribution meetings and all that. So, the VIVA portion, there was no business dealing with the VIVA, but the VIVA meeting convenes at the end of all that other activity. And so, as you can see in the notes, there was very few items that.
But
were
I
actually-
think it lasted more than a minute, Mr. Chair. That's kind of silly. I mean, Does that make sense to you? And the next meeting started at 2:44 and ended at 2:46, 2 minutes for people to give testimony. I think someone ought to check their watches next time they do it. Just a comment. Okay, that's all. Nothing lasts 2 minutes or 1 minute. So by the time you call the roll, it's a minute up. So someone ought to take a look at it. That's all. Thank you, Madam Chair.
Any further discussion on communications? All in favor, say aye.
Aye.
Opposes the same sign. Motion carried. Moving to the regular agenda, we will start with an update from Jim Ryan.
Good morning, Madam Chair, members. There certainly are a lot of powerful women in this room today. I will be brief because unlike you, the legislature is not in session this month. They are off this month, and the dates for session for next month are all tentative. So what that really means is that the governor and leaders are still negotiating the budget, and they don't really want to come to town unless they have something to vote on it. So I'm not sure that there will be many session days in August. But the two items that we've been closely involved in, as you know, are the raise the age issue that has passed both the House and the Senate, that changes the age from 18 to 17 for adults in the criminal justice system. That series of bills also has a budgetary component because counties will be spending more money to deal with juveniles. And so that is part of the budget negotiation. So yes, they passed both houses, but they have not yet sent them to the governor for signature, so we're still waiting for that to happen. I don't think that there is going to be an issue with it. I think at the end of the day, those will be passed on to the governor and they will be signed. The other issue, as you very well know, is our breakfast program that we have been working on to get into the budget. We are in the Senate version, and it is right now a point of difference. What that means is pretty much everything in the budget is a point of difference. The Senate passes all of their bills, the House passes all their bills, the Senate turns down all the House bills, and the House turns down all the Senate bills, so they all go to conference. That's what we wanted, that's where we are. That doesn't mean, to be that there's a point of difference between the House and the Senate is not necessarily a bad thing, because everything is a point of difference. So it all goes to conference, and that's where our work is now. So we will continue to work behind the scenes to make sure that that is protected in the budget. And I'll stop there if you have any questions.
You said our breakfast program is in the Senate version of the budget?
Senate K-12 budget, yes.
Okay, thank you.
We do need to work the House because the chair of the House K-12 budget, Aaron Miller, is not a fan of this program.
Okay. Chair Woodward?
Is there, okay, we've got incredible leadership advocating our position. Is there any additional things that this board might be able to lend itself to assist in? I mean, reaching out to the Oakland County delegation, sending a letter to the Oakland County delegation?
I think a letter, I know a lot of you have already talked to your senators and House members because I've been meeting with them. A letter would be great. I mean, we have to keep hitting this thing because we're gonna get to the point now, as you well know, former legislators in the room know that we're gonna get into the quadrant meetings here, and this is where everything's on the table and something's gonna get thrown out in the next couple of weeks, and we don't wanna be thrown out. So yes, I think because we have wholesale bipartisan support of the board, right? I think a letter, especially to at least the appropriations and leadership, I think the key is gonna be Speaker Chatfield intervening on our behalf, telling Aaron Miller, the chair of the subcommittee, let this pass. And he's effectively, Miller has actually told me, he says, if the speaker says it's good, I'm not gonna fight him on it. So that's where we are on the House side. Does that answer your question, Mr. Chairman?
I think Shelley and I are gonna take the speaker out to lunch.
Yes.
Is there anything, I'm sorry, Jim, but is there anything in the Senate on this at all? Or we're just gonna send it over there? And do we have a sponsor over there? Is there somebody?
For our breakfast program?
Yeah.
Well, Senator Schmidt is the chair of K-12,
Right.
and Senator Stamas, he's the appropriations chair, have put it in there for us. So, the sponsor of the K-12 budget, which is billions of dollars, is Schmidt. We're just a rounding error in that budget,
I know,
so,
yeah.
but it's a big deal to us.
Well,
That $137,000 a year for 3 years, as you remember, will get us 12 million back in federal funds that are just sitting in DC. So it's a pretty wise investment.
I agree, but, yeah, maybe we need to do some talking to some people about this.
Chair Woodward.
Just on that, Senator Runstead was also very instrumental.
He was.
In going to bat to get it included in the Senate. So, I mean, as an Oakland County Senator, I've personally expressed my appreciation to him, and our Senate delegation definitely stepped up to assist here, so just gotta work the House.
And Senator McMorrow did as well.
Correct.
Yeah. Well, they all kind of did, but those two really pounded it pretty good for us.
Any further questions? Well, thank you, and thank you for the update, and whatever we need to do for both the budget, that as it affects Oakland County, and the program, the breakfast program, let us know.
Sounds good, thanks.
Thank you. Next item on the agenda is MR 19212, Board of Commissioners support for Michigan Senate Bill 284, banning conversion therapy as a means of changing an individual's sexual orientation or gender identity. And we have, I have a motion to bring the resolution forward, moved by Commissioner Gershenson and supported by Commissioner Nelson, and will be presented by Commissioner Zach.
So my small town of Huntington Woods is the first municipality in the state of Michigan to pass a supportive resolution banning conversion therapy. And there are many municipalities across the country, and there are states that have legislation that are banning it. And there is legislation that's been presented in the state of Michigan for this purpose. And yes, there are things happening in the state of Michigan where there are communities that are trying to conduct conversion therapy. So this is our opportunity to make a statement that we don't want this to happen in our state, and urging, stating to our legislature that we would like to have legislation that does ban this practice in our state. So I hope you'll support.
Discussion? Commissioner Tom?
Thank you. Commissioner Zach, is this performed anywhere in Oakland County?
Not that I am aware of, but
Okay.
it is a problem in Michigan. And again, it's just us weighing in on this particular practice.
May I continue, Madam Chair?
Sure.
There's nothing in this resolution that states that Oakland County Health Network, which is formerly CMH, does not do this, period. And I have not had time to write an amendment so stating, because when I spoke with people there, they said, oh my gosh, this is horrible, that anyone even think of doing this. So I don't want to vote no, but I don't have time, there's no time, we've got a whole room full of people to write an amendment to this. I'd like to put this on, I'd like to vote with this, but also have the understanding that it would go on the regular agenda if possible, so I can amend it or pull it off the agenda. Because I want to make sure that people know that Oakland County Community Mental Health, or whatever it's, Oakland County Health Network now, never has and never will participate. We are part of that in this county. So if that would be permissive,
I will happily support your amendment on the floor
Okay.
with you.
Yeah, okay.
And would ask that we put this on the regular agenda, and I would prefer to have you support this today.
Okay, as long as I know it's going to go on the regular agenda, because I don't want anyone in the county to think that this was ever a practice of public mental health / substance use, or whatever, ever, so.
So our staff duly noted that it's going to go on the regular agenda. Thank you.
Maybe they duly note that I need an amendment.
Any further discussion? Not hearing any, would you please call the roll?
Nelson,
Yes.
Gershenson,
Yes.
Lubes.
Yes.
Tubb,
Yes.
Woodward,
Yes.
Quarles.
Yes. Motion carried. Thank you.
Thank you.
Thank you, Commissioners. Commissioner Knight. Next item, item 3, Human Resource Department improvement to the vision benefits coverage for calendar year 2020. Is there a motion to move? Moved by Commissioner Todd, supported by Commissioner Wu. Thank you.
Good morning.
Good morning.
I'm here before you today with a resolution to improve the vision benefit for county employees and retirees, starting in 2020. It wouldn't be effective today if you approve it, but starting January 1, 2020. We were looking at some improvements that we could make to the current vision coverage. Right now, we're, coverage for frames is limited to $67, and we'd like to up that to $100 of coverage. And also, contact lenses are covered at $35, and we'd like to up that to $50 per time period. So the standard vision coverage is coverage every other year. And then if employees want to buy up during open enrollment, they can have the same vision coverage, cover things every year, every 12 months. So this would affect both the standard and the high vision plan. And there are resources already in the budget to cover this. It's a relatively low cost. For employees, the fringe fund, the cost is only estimated about $36,000. The current spend, like for instance, last year, because we're self-funded for vision coverage, but last year, the spend for employees was about $219,000. And the budget's set for 2020 at $300,000. So we've talked with the Fiscal Services Department, and they don't even think it needs a budget amendment to do this. And I'm happy to answer any questions that you may have.
Commissioner Todd.
Thank you. Now, let me get this straight, because sometimes, you forget. This includes all employees, union and non-union, is that correct?
Well, yes, correct. If it passes today, for sure, it's the union, or the non-union people, the unions that have Me Too agreements for benefits.
Which ones would those be?
Well, I think it's everyone except one sheriff command.
Okay.
And then it's, even though it's an improvement, it still has to be negotiated with them, but it's probably not gonna be a problem. I'm just,
I think everyone wants more care. So,
Right.
okay, so everybody gets it.
right.
Yeah, okay. Thank you. Thank you, Madam Chair.
Further discussion? Madam Clerk, would you call the roll, please?
Gershenson,
Yes.
Lubes.
Yes.
Tubb,
Yes.
Woodward,
Yes.
Nelson,
Yes.
Quarles.
Yes. Thank you. Motion
Thank
carried.
you.
Might as well stay there. Item 4, Human Resource Department improvement to the dental benefits coverage for the calendar year 2020. May I have a motion to bring it forth? Moved by Commissioner Todd, supported by Commissioner Gershenson. Thank you.
Okay, so this one is for the dental coverage, same effective period, 2020. For this one, we're actually looking at 4 different improvements to the plan, which I can summarize here. The first one is to the high dental coverage. That's the one that employees can buy up to during open enrollment. And currently, the annual maximum coverage on the dental per year is $1,250. And so what we're asking for is to increase that per year to $1,500, just on the high dental coverage. And then the other three improvements that we would like to make affect both the standard coverage and the high. And that's to add coverage for brush biopsies, which are tests for oral cancer that can be done in the dentist's office if the dentist has the equipment to do so. It's a relatively newer procedure. To also add coverage for composite fillings, which are the white fillings, because silver they're not used by many dentists anymore, and they're not really the preferred choice. And then also to add coverage for dental sealants for children up to age 14, and that's to protect against cavities. So to make all of these changes, it's projected that annual cost would be $149,000. And this would require a budget amendment, and fiscal services added in their figures for that. And if you have any questions, I'm happy to answer them for you.
I'd just like to, I got her. I'd just like to add that I am glad to see that we're looking at the dental coverage. I think everyone knows that the importance of your dental treatment to your whole body and your whole health habits. Commissioner Tom.
What is the charge for, I don't see it here, for the nominal, how much per pay for the nominal insurance?
Sure. To buy up to the high dental coverage is, if you're a one-person coverage already, it's $1.15 per pay period biweekly. If you've got two-person dental coverage, it's $1.73 per pay period. And if you have family coverage, it's $5 a pay period.
Thank you, Madam Chair.
Okay. Any further discussion? Clerk, would you call the roll, please?
Luce?
Yes.
Tuck?
Yes.
Woodward?
Yes.
Nelson?
Yes.
Gershenson?
Yes.
Quarles?
Yes. Motion carries. Thank you. Thank you. Moving to item 5. Miscellaneous Resolution 19214, Board of Commissioners, declaration of support for the registered nurses of Beaumont Royal Oak right to organize without coercion, intimidation, or other influence. Motion to bring forth, moved by Commissioner Nelson, supported by Commissioner Gershenson. And
Sure.
presented by Commissioner, Chair Woodward. Commissioner Malone, are you gonna? Okay.
I'm here.
She yields to the chair.
I'm sure we had lots of questions that can come up here, so I apologize, let me just bring it up here. All right, I want to say to the committee, the chair, thank you for placing this item on the agenda. First, and I think you've heard I heard a lot of information during public comment about this. First, I think it's important, I want to address why I was very interested in bringing this resolution forward. First, I think it goes without saying that I think everyone in this room is a strong supporter of nurses, myself included, and I'm a particularly strong supporter of Beaumont nurses. Beaumont Hospital, which everyone here knows is in my district, I have been a strong champion for Beaumont my entire 20-year plus public service career. Not only as the largest employer, but being born there myself, I helped deliver both my children, a tremendous number of constituents that are employees. Beaumont is absolutely key and core to our economy, and we want the gold standard. We want a gold standard for healthcare at Beaumont, has a very strong reputation to preserve and maintain. Some weeks back, I was approached by some nurses that you heard today and many others, to share some concerns. I had read about in the paper of an effort underway to explore unionizing, and in my opinion, that's a decision that workers have a constitutional right to be able to do. I met with them. Probably the most troubling aspect of all this is that in any effort, in any situation in which you have a group of employees that are choosing to unionize, they should be able to do so, and if a majority of workers say yes, then a union is formed. If a majority says no, a union is not formed. And that's really what this resolution is about. What troubled me most, I've expressed this to leadership at Beaumont, is a pretty heavy-handed tactic that frankly is employed by a lot of employers when union drives or union efforts are afoot. And those are efforts to spread information under the guise of public information to chill or deter or persuade against, weigh in, if you will, in the decision that frankly should rest entirely with the employees. Beaumont's retained contractors that are actually engaged in this activity, and you can pull up the subcontractors, their own websites. These are contractors that celebrate victories of decertifying unions, preventing union drives, what have you. Now, I actually don't care of one's position on whether you support unions or don't support unions. I think it's pretty clear where I stand, but that's not what this resolution is about. This resolution is about standing by and supporting the right of the nurses at Beaumont to pursue this question without interference from an employer, because it's the right thing to do. It's the right thing not only to support our nurses, but frankly, all employers should not just take a formal neutral position, but should actually stay out of a decision that should be rested with employees. Probably the most troubling as a public body we'd be weighing in on this. This county has given millions of dollars to Beaumont over the years in the terms of to help offset costs for uncompensated care. This body formed the Oakland Health Plan that in partnership with Beaumont to create the conditions to get a medical home to people who didn't have health care, to keep people out of the emergency room. Public bodies have extended and utilized their ability, bonding authority and what have you, to help grow the campuses. And appropriately so, because we want a robust, we want the best healthcare system, and we show up in using our ability to be able to do that. So when I hear that a firm has been retained at the cost of hundreds of thousands of dollars to engage in anti-union propaganda, dollars that frankly should be better invested in healthcare, when I hear that nurses are being pulled off the floor to go to meetings, voluntary, strongly suggested meetings to get this information, that's payroll dollars of nursing care that should be going to patients. So I am troubled by that, and that shouldn't be happening. And frankly, we're better than this. Beaumont's better than this. Before this resolution was introduced, was hoping that these actions would stop, but they haven't, I hear. So that brings us here today. This resolution is to support Beaumont nurses. If there are nurses that don't want to support a union, they can make their voices heard. For those nurses that want to support a union, they can make their voices heard. And frankly, without any interference from Beaumont administration. And so that's why this resolution is before us. I think it's the right thing to do, to show our public support for our nurses, and allow their constitutional rights to form a union and not to form a union to be exercised. And so I'm happy to take any additional questions, but the resolution is pretty short, it's pretty direct. This is not taking a position in support or against the formation of a union. It is, however, asking Beaumont to stop these these anti-union activities, not engage in direct interference with this, let the employees make the decision on what's right for them. And you've heard eloquently already this morning of the cases why some and maybe why others don't, but that should be allowed to work it through its normal process. The last thing I'd say, the reason that this firm has been retained by Beaumont, and let's be very clear, it's to try to prevent a vote in the first place. That is the only reason this firm exists. This is what this firm is hired around the country to do. And so, again, it's disappointing that it's happened. It's disappointing that healthcare dollars are being used in this way. But I like to think that the past. I'd like us to move forward, let workers self-determine what's best for them, what's right for them, and let nurses get back to what they do, is provide the absolute best care to their patients.
Thank you, Chair. Any questions, discussion?
100 years ago, women won the right to vote, and I firmly believe that voting is a right. It's a privilege in our country we should all take advantage of, and asking the employees to vote to unionize or not unionize is a priority. It's important. It's our constitutional right. I can only echo what Chief Woodward and Commissioner Zach have said already, that it's an important to hear from employees to allow the nurses to say yes or no.
Thank you. Commissioner Tom.
Thank you. To the union people, I absolutely support your right to go out peacefully and not coercively and ask people to join your group. To Beaumont, I think you realize that, I have to stop 1 minute. My husband was a Beaumont doctor, okay, for 1 year. He was on two, he was the first family doctor on the Troy staff. But he was also on Crittenden staff and solo practice, and he couldn't do both things. He had like 35 committee meetings in both hospitals, and he was chief of the family practice department at Crittenden, so, okay, that's number one. And number two, he was in the United States Navy Medical Corps, so I just want to make sure that people understand that. But I don't think, and to Beaumont, I hope that you will let people vote however they choose to vote without coercion. But looking at that being said, I don't believe it's up to us to take on private industry. We are a county government organization. I think we have unions here and non-unions. And in this county, when you get a pay raise, everybody gets the same thing, union or non-union, period, end of story. So you have your choice here. And we've had unions come and we've had them go, okay? And that's the privilege of being an American and living in this country. So I don't think, I'm not gonna step into GM or Ford or Chrysler, whichever one is struck this fall. It's not my business. I don't think government belongs telling industry how to run their industry, and particularly on these issues. So I'm saying that I'm hoping that the folks who want a union and don't want a union, or however it works, can work about this peacefully. I'm not going to support this because I don't think we need to stick our nose into private companies and unions. I just don't believe in it. So mine is a no vote for that reason. I had some questions as well. I would hope, I understand Beaumont's part because they have a right also to speak to people about what you're doing. And yeah, it is an adversary position, okay? And maybe something like what we have in Oakland County, where some people are in the union and some people are not. But everybody gets the same pay, because basically what union rights are about primarily is about pay. Let's be honest about it, in working hours. And I'm hoping that that can be settled peacefully among all the parties. So I won't be supporting this because, again, I stress, I don't think that we as a government belong in union negotiations with a private, and Beaumont is private. And I get it, we put some money into Beaumont, but and they've used our bonding or whatever. That's great, that's what we're here for. Thank you, Madam Chair.
Thank you, Commissioner, but as I understand it, Beaumont is a not-for-profit hospital. So we're not dealing with a private industry. Mr. Chair.
Thank you, Madam Chair. And I definitely, respect, Commissioner Taub and, her point of view. I think the title of this resolution really speaks to it. Declaration of support for the registered nurses of Beaumont Royal Oak right to organize without coercion, intimidation, or other influence. I look at it a little bit differently than Commissioner Taub stated, in that we represent the people, many who are Beaumont employees, many who are, public nurses, and the right to organize without interference from an employer. And so I think it's important to take a stand when a practice that's being employed right now is in place to say, no. I guess I also want to also stress, the unions really is only about pay. And I think there are economic issues and non-economic issues. I think their quality of pay, working conditions, mandatory overtime, patient-nurse ratios, like all of those things can be accomplished through a negotiated practice. And I think nurses are revered as some of the revered as the most important work, particularly when it comes to caring for patients. And I think, again, I don't think there's anyone in this room that disagrees with that sentiment. And a union, is a vehicle available to folks who choose to form one to actually engage in those things. And I think, so I don't want to trivialize that the union isn't important, because I think, it is a negotiation. It's and in place all around the country, including here in our county, that some of our public health nurses are represented. Again, I can respect Commissioner Taub's position on this. I disagree. I think that this resolution very much is about saying publicly where we stand in terms of supporting workers and supporting employees in their right to engage in collective bargaining without the interference of an employer. And frankly, I think it applies to all workers. I am elected to represent everyone in my district, and this is a value proposition that's baked into our Constitution. And so in my formal capacity here is why I'm standing here, not just to support rights of all workers, but particularly the right of nurses and express our support for nurses.
Commissioner Gershusa?
Yes, I feel like we have heard both sides of this issue. I'd like to call for the vote. Oh, is that true?
Not true. Yes. Yes, it's a vote. You bringing forth the call for the question?
I am.
Okay. We have to, yeah. Supporter? Second by Commissioner Nelson. Madam Clerk, would you call the roll, please?
Gershenson?
Yes.
Lubes?
Yes.
Taub?
No.
Woodward?
Yes.
Nelson?
Yes.
Quarles?
Yes. The motion passed. We will now take a vote on the resolution. Madam Clerk, would you call the roll, please?
Taub?
No.
Woodward?
Yes.
Nelson?
Yes.
Gershenson?
Yes.
Lubes?
Yes.
Quarles?
Yes. The motion carries. Thank you. Next on our agenda is miscellaneous resolution 19222, Board of Commissioners support for the 2019 Arts, Beats, and Eats Festival. May I have a motion for the resolution? Moved by Commissioner Gershuson, supported by Commissioner DeLue. Chair,
I am back. All right, thank you, Madam Chair. On behalf of myself and Commissioner Gingell, this is something that we've done, the last many years. We do this in partnership with Oakland County Economic Development, which matches us in our contributions and support. People may remember Arts, Beats, and Eats is the end of summer huge gathering. Started in Pontiac, now in Royal Oak. That our county executive, Brooks Patterson, was a driver of creating this premier event in the region, and it has it
produces an incredible economic boon for the area, a quality of life initiative, and ask for your continued support the way that we've supported this in the last many years.
It's a fun event. Any further discussion? Madam Clerk, would you call the roll, please?
Nelson,
Yes.
Hershenson,
Yes.
Moves,
Yes.
Todd,
Yes.
Woodward,
Yes.
Quarles.
Yes. Motion carried. Thank you. Next item is miscellaneous resolution 19223, Board of Commissioners support for the expansion of Michigan civil rights laws for the LGBT individuals. It's, may I have a motion to move the resolution? Moved by Commissioner Liu and supported by Commissioner Nelson.
This resolution supports the Civil Rights Act of 1976 that prohibits discrimination on the basis of religion, race, color, natural origin, age, sex, height, weight, etc. This would expand the movement to include discrimination against the LGBT individuals. This has been supported by various senators and representatives, and we in Oakland County would like to support expansion of the civil right protections for LGBT individuals.
Any discussion? Commissioner Tom?
Thank you. In 1976, an African-American woman from the city of Detroit desperately wanted to pass a civil rights bill. But she knew that she couldn't do it because her team was in the minority. So she found a very willing Oakland County resident who represented Oxford and Lake Orion by the name of Mel Larson. He was a Republican. And that's why we have the Elliott Larson Civil Rights Bill. He sponsored it, he pushed it through, and now I believe is a time to expand it. However, I was a little late this morning because I spent about a half an hour on the phone with Mel Larson talking about this resolution. And he asked the following, okay, whether you choose to comply or not. Obviously, I'm a minority of one, I should say. He would like to have the 1, 2, 3, 4th whereas stricken, okay? Whereas in May 2018, and the three whereas is there because he did not feel as if they had anything to do whatsoever with this. Okay, he would like to have, so I'm going to make that, that's one thing he would like to have done. And other than that, he totally supports this resolution, okay? There are 3 whereases that start, the first one starts whereas in May 2018, the second one follows it whereas in July 2018, and the third one is whereas the Civil Rights Commission, okay? Because he definitely feels that, like most of us, that this was not up to a committee to decide, but up to the legislature. So I'm going to make that motion. I'm going to make that motion to remove that from the agenda, those 3 whereases.
Just, you mean to strike it?
Strike them, yes. From the resolution, yes, excuse me.
Madam Chair? I'll support for purpose of discussion.
Okay. Support, it's moved by Commissioner Tom, supported by Chair Woodward, and I apologize for reading it.
Yeah, this is the part that, I mean, it speaks to, just for clarification, we're talking about striking out language that references that the Michigan Civil Rights Commission took, basically stated there, going back to May, voted to expand its interpretation of the state's Elliott Larson Act to include the protections of discrimination based on sexual orientation and gender identification. And then the other 2 relate to actions former Attorney General Bill Schuette came in and then said, nope, you can't do that. And then the Civil Rights Commission came back and said, thank you, Mr. Schuette, but we're moving forward. And now we've got actually a current Attorney General that actually does support that interpretation. I hear the point being that this is slightly unrelated to the legislation that's the purpose of the legislation is to actually add LGBT protections into the Elliott Larson's Act in the state of Michigan. So and these are all factual events that actually occurred. If these were stricken, Commissioner Taub, will you support this resolution?
Yep.
Commissioner Taub, I just want to be clear, you would like the whereas in May 2018 stricken, is that correct?
There are three whereases. Whereas in May 2018, go on there, and then whereas in July 2018, and the third one is whereas the Civil Rights Commission, the Michigan Civil Rights Commission stated. Okay.
Yeah, I mean, I think it's, Madam Chair, if I may,
Yeah.
that all three of these things are factually accurate events. The purpose of this resolution is basically to empower our lobbyists to go and advocate for the adding of LGBT to the Elliott Larson Civil Rights Act. So I think we're always stronger when we come together. These are whereas clauses, they're not actionable clauses. So I'm fine removing that as long as that comes with the engendered support of our colleague.
Okay.
I still agree, those are all accurate statements, but, I mean, if that moves us forward as a united front, I think it's in the best interest of everybody.
Any further discussion? Commissioner Taub and then
Yeah,
Commissioner.
Mel said this morning that it should be expanded, because I've jotted notes down here, if you'll excuse me, to include sexual identity and gender identity, or sexual and gender identity. And he agreed to that. And I would like to have that, yes, I would like to have that stricken, because he's the one that I read all this stuff to, okay? And, you know, he is a living embodiment of, and he wasn't, by the way, in all fairness, he wasn't ready to have this in the Civil Rights Act about 5 or 6 years ago. But we've since had breakfast and lunch and spoken, and as of later this morning, so.
Thank you, Madam Chair. Okay, any further discussion? Okay. The amendment would strike the whereas that begins with May 2018. The next whereas, including July 2018. And then the third whereas, whereas the Michigan Civil Rights Commission stated. That is the proposed amendment before us that has been seconded. With that, Madam Clerk, would you call the roll?
On the amendment, Lubes,
Yes.
Tubb,
Yes?
Woodward,
Yes.
Nelson,
Yes.
Gershenson,
Yes.
Quarles.
Yes. Motion carried. Now, Commissioner Todd.
Yes, Mr. Chair, I would like to also, if possible, have this put on the regular agenda, because I think everyone ought to have the opportunity, rather than, or they may request it to be pulled anyhow, so I don't know. But I think people ought to have the opportunity to vote how they feel, what they feel is right. And I will stress in my caucus what Mel said. Okay?
Any further discussion? Now the vote is for the resolution as amended. Madam Clerk, would you call for it?
Gershenson,
Yes.
Lubes.
Yes.
Tubb,
Yes?
Woodward,
Yes.
Nelson,
Yes.
Quarles.
Yes. Motion carried. Anything, no further business for today? I move for adjournment. Support. Moved by Commissioner Nelson and supported by Commissioner Gersison. Committee ends at 10:54.